This is an interview with Dr. Thomas Mack on July 11, 2008 at the Centers for Disease Control and Prevention in Atlanta, Georgia, about his role in the Smallpox Eradication Campaign. The interviewer is Melissa McSwegan. With this interview, we're hoping to capture for future generations the memories of participants and their families involved in eradicating smallpox. This is an incredibly important and historic achievement, and we want to hear about your experience. I have some questions to guide you, but please feel free to recount any special stories or anecdotes that you remember about events or people. The legal agreement you signed says that you are donating the oral history to the U.S. federal government, and it will be in the public domain. So for the record, could you please state your full name and that you know you are being recorded?
My name is Thomas Mack, MD, and I know I'm being recorded.
Okay, thank you. Well, to start out with, can you talk about how your education and upbringing led you to a career in public health?
Well, okay, I was raised on a ranch in western Nevada, and I needed to get away from home to go to college, and so I set up a surveillance scheme for scholarships, and I got a scholarship to a very good school in Minnesota, Carleton College, liberal arts college. And at the time that I started out there, I thought I probably would go into zoology somewhere. But because many of the people who were my friends at Carleton were going into medicine, I decided that there was no reason why, if they could, I couldn't. So I applied to medical school and went to Columbia Medical School. And because I've always been interested in places and languages and differences between groups of people, I presumed in medical school that I would go into infectious disease, and was rather adept at diagnosis and treatment in medical school, and went on to an internship in internal medicine and then a residency in internal medicine at the University of Washington. And because I was interested in infectious disease and the differences between people, I thought I would go to CDC. And so I entered the CDC class of, I guess it would be 64, 65. I went in 64, and I guess it was the class of 65. And when I went, I was arbitrarily assigned to the smallpox unit, which was in fact the beginning unit devoted to smallpox at CDC. And we were involved in studying vaccination efficacy and the dangers of vaccination, and from literature, something about smallpox epidemiology, although of course there hadn't been any smallpox transmission in the United States for decades. But we looked at the historical record of smallpox in the United States, and I began being interested in importations of smallpox into Europe, which I later published about. And then the opportunity came up for me to go to Pakistan by a friendly relationship between Alex Langmuir and a person at the University of Maryland who had what was then called an ICMR. I forget the exact meaning of the letters, but basically was an organization to study tropical disease in a foreign country, funded by American sources. They were situated in Lahore, Pakistan, with a Pakistani institution with whom they allegedly were cooperating, and they had a place to study and a set of facilities supported by USAID in Lahore. And so in must have been January 1964, my wife and young son set out for Pakistan. And when our plane was over the Atlantic, the war between Pakistan and India erupted, and there were dogfights over Lahore between jets from the two countries. And so I was told not to go any farther, to stay in Copenhagen, where my wife was from, and I was sent on a few small assignments locally, and then sent with Rafe Henderson to West Africa to organize the agreements between smallpox eradication and measles control programs at CDC and the French-speaking countries of West Africa. So Ref and I went to each of the French-speaking, Francophone countries of West Africa, attempting to do just that with moderate success, I would say, and some initial embarrassments, which I suppose should have been described in the context of African epidemiology rather than Asian. But one of the things that happened to us was that when we first arrived, we were both very tired from a long flight from Marseille, and we were both very hungry because we didn't get any food, and so we were met by the French officer from the French organization in Bobo-Dioulasso, and met with a long string of rapid French welcoming us, and finally he took us to our place of sleeping, and we took a detour and went and got a big breakfast and went back and were preparing to go to bed, and he showed up telling us that basically that he had invited us to his house for dinner. And so we went with him to his dinner just after eating a full meal by mistake. But anyway, we did in fact go to all of the Francophone countries, and then I went back to Copenhagen and awaited permission to go on to Pakistan. And by the time that we went on to Pakistan, my wife had delivered a second child in Denmark, so we took a 3-week-old baby and my 2-year-old son, I guess, to Lahore, Pakistan. Now, it was more or less determined by virtue of my original assignment that I was going to be studying smallpox, and I was excited about that. But I had to overcome a number of I suppose you'd call them obstacles to do that. The first thing was that most of the people from the University of Maryland were bench scientists, and they were interested in certain aspects of tropical disease from the standpoint of laboratory investigation. There were no bona fide epidemiologists. Then some people who were trained in chronic disease epidemiology showed up, whose methodology was set-piece case control and cohort studies with very carefully set out in advance statistical goals and which were just simply not amenable to studying outbreaks of smallpox which occurred in places unpredictably specified. And there was a fellow who joined me in Lahore from the University of Maryland named David Thomas, and David and I basically worked together for the next 2.5 years. We collectively decided that we would try to solve several specific questions. One was, could we identify the most efficient groups of people, demographically speaking, to vaccinate in order to halt transmission, demographically meaning age groups and gender and anything else that was pertinent. We also wanted to know whether or not the descriptive epidemiology of smallpox occurrence led to any other suggestions about more rapid eradication. And also we had to set up methods of ascertainment and surveillance. So it took a while before we actually could convince the chronic disease epidemiologists and the laboratory bench scientists that we were basically going out as outbreak investigators rather than doing set-piece epidemiology. But once we got that settled, then we had to talk people out of a truck or a Jeep equivalent, Land Rover, on a regular basis, and then we had to find somebody to go with us. Now, I began taking lessons in Hindustani in Urdu, but quickly learned and realized that while Urdu was the national language of Pakistan, nobody in Lahore or in the areas that I was going to go spoke Urdu as a regular language. They spoke Punjabi, and nobody was willing to teach Punjabi. So I learned some Urdu, and I managed to use it in Karachi and India from time to time, but only a little bit in the field. And so we had to learn how to understand the responses to questions in Punjabi. The second problem was that we, as in most developing countries, a person who is willing to work as a subordinate staff person in the field is usually a person who's been trained as a driver or a laboratory technician, and has a certain degree of self-importance and also a certain value that is attached to the presence of a job. And the likelihood of continuing a job is associated in the minds of such people oftentimes with pleasing the people who we are working for. And that meant in this case very often that instead of translating what the respondent had actually said in Punjabi, we were told what the translator thought we would most like to hear. And so we had to go through a number of people, or I had to go through a number of people to try and solve that problem. And I finally found one wonderful guy who throughout the next 2.5 years acted as translator in a very accurate way, and told us sad things when we needed to hear sad things and good things when we needed to hear good things, and was quickly learned what it was we were trying to do, and became very inventive and thoughtful in his formulation of questions to people. So basically, several times a week, we would get in the Land Rover and go out to villages which we had been previously told there might be smallpox in, and followed each village back to the next villages where there might be smallpox until we found an outbreak, or we actually surveyed the available outbreaks, took the necessary information, and continued. So over the course of the ensuing 2.5 years, we basically investigated 100 outbreaks of smallpox, interviewed every family member of a case, if not the case themselves, tried to learn how the outbreak had begun, and where the person who entered the village to spread the disease had come from, and how the disease has spread within the village. And and then we set up, subsequent in the last year that we were there, very similar studies in what was then East Pakistan, now Bangladesh. And this was prior to the war between East and West Pakistan, prior to the formulation of Bangladesh as a country. And basically were similarly successful in investigating outbreaks in Bangladesh. And when we were finished, we had learned several things. We learned that in West Pakistan, the people who started the outbreak were almost always children which had been taken by their mothers to visit the mother's family in another village and had been infected in that other village, and thereby concluded that vaccinating school children or preschool children would be the most effective way of getting rid of smallpox in Pakistan, in West Pakistan. And of course the least expensive way, because to go out and try and vaccinate men in the fields and to spend the time necessary to talk women in Purda, of whom there were a minority in the villages, into permitting vaccination would be very difficult and very costly. So school-based and preschool-based programs of vaccination would have been very effective. The second thing we learned was that it was very clear from the seasonal distribution of smallpox that smallpox was an incredibly seasonal event in West Pakistan, that there were periods during the wet season where in the whole province of Punjab, which is where we were working, and actually probably in West Pakistan as a whole, there were really only 2 or 3 villages where smallpox existed. So I tried to convince the Pakistani authorities that if we could have the cooperation of 1 military patrol or 2 patrols, we could probably eliminate smallpox from Pakistan within a year. But this was not a credible proposition to anybody, and we didn't have particular clout to be able to convince people that that was the case, so it never happened. The third thing we could clearly conclude from studies in Pakistan, and they were also corroborated by later examination of the importations to Europe, was that smallpox was really not a very infectious disease away from the bedside. Almost everybody who was contracted smallpox had been exposed at the bedside or the charpoy side or within the room of a person who had smallpox. People who lived meters away or down the path, down the stream, or anywhere else in the village normally were not exposed and did not contract disease, which meant that while the disease was very infectious within a short period of space, it was not infectious over a long period of space, which has lots of implications for smallpox importations subsequently, and also had serious connotations for eradication efforts. Now, this was, we went to Pakistan in 1964, or we started out in 1964, were there in no, that's not true. We started out in January of 65, I was mistaken, and came back in the spring of 68, at which time eradication efforts in West Africa were underway, but certainly no efforts in Pakistan had begun, and there were efforts in India that were underway. But I never actually had a direct role in the eradication program itself in either Africa or Asia, even though all of this work was done in Asia. Now you should begin your questions, if you have any.
Well, you've talked quite a bit about brokering agreements between, the governments and all the parties involved in the program. What did you find to be the most challenging aspect of that work?
Well, there were a couple of, obviously it was very challenging to take a Land Rover and go out into an area the size of a small American state, a middle-sized American state, just restricting ourselves to one district. And we actually did begin by taking 3 or 4 districts and studying smallpox wherever we could find them. But we decided that we wanted to be comprehensive and study every outbreak of smallpox which occurred in one district, which was composed of about 1 million people. And we did that over the course of 1 full year. And then we studied a lot of other outbreaks in other districts. And of course, Pakistan is not necessarily the easiest place to get around in. We had lots of Land Rovers mired in mud. We had to be pulled out by bullocks, and we had driving up and down the Grand Trunk Road, which was the main road that the English built between the northern part of Pakistan all the way down past Delhi. Was a 2-lane road, and most Pakistani farmers were using bullock carts, and there were buses which were piled high on the top of the bus with people, as well as inside the bus, which traveled at breakneck speed on the 2-lane road. So that was fairly dangerous every day. We had a few real scares. One of them came about because the military major, the Pakistan Army major, who happened to be, or I guess he was a colonel, who happened to be the director of the Pakistani Collaborative Agency, where no effective science at that time was really being done. People were holding down jobs, and they were doing a few minor things, but nothing that anybody would get excited about scientifically. He was a former malariologist with the Pakistani Army, and unfortunately, I think he probably was very close to being a paranoid schizophrenic. He, over the course of the time I was there, became more and more angry that he was not given more power and more money to dispose of, and he was actually his opinions were not being sought by the leaders of the institute I was associated with. I don't know what all the basis for his anger was, but I have it on good authority that he began hiring what in Pakistan were called gundas, which really were thugs who would beat up the Pakistani employees of the Americans on occasion, when not every day, but just occasionally, just to keep everybody a little bit frightened. And one day I came back after having been out all day long from about 4 o'clock in the morning to about 8 o'clock at night, where we worked up a couple of outbreaks. We spent most of our time off the Grand Trunk Road, fortunately, because we got back again, and as we pulled to a stop in the compound of the Institute, the brakes were failing. And when we investigated the brakes, somebody had put sand in the brakes. And had we been on the Grand Trunk Road and had we had to stop very suddenly for a bus or a bullock cart, we would have been in real trouble. So that was a fortunate event. I had one other scare of a different kind. We were in a Jeep, in a Land Rover, and we were just a driver and I. And we were in Sialkot province, which was Sialkot district, which is maybe 150 miles north of where we normally were working. And we were looking for a small village where we had been told that there was an outbreak. And we came over a hill. And as we came over the hill and started down the other side of the hill, one could see right ahead of us another hill. And there was another Land Rover sitting on the top of the hill, facing to the left. And the people who were sitting in the other Land Rover had Sikh pugris on, Sikh headwear. And that meant that they were Indian Army, not Pakistani Army, which means that we had crossed over the border by mistake and without realizing it. And had they seen us and stopped us and confronted us, I'm sure that I would have been in an Indian jail as a spy, because at that time there was still intermittent activity between India and Pakistan. So those were the only two times I think I could, well, there are other times when we had very frustrating times, but those times I got my adrenaline flowing a little more than the others. And then was my 3-year-old son got chickenpox, and that didn't frighten me very much because I knew a lot about smallpox, and I knew he was protected, and I knew there was no smallpox around. But my wife was not as easily convinced that there was no problem. But we got over that in a few days.
What were some of the other challenges that you faced having your family with you while you were in Pakistan?
Well, Pakistan is not the easiest country to live in for Westerners. Now, and when we had a lot of good Pakistani friends, but invariably they were male friends, and it was impossible for me to actually meet any Pakistani female friends except for professionals, and there were 1 or 2 professionals who worked with us. Some of them were Bengali, because this was at a time when Pakistan was, both sides of Pakistan were in the same country. And there were 1 or 2 who were Punjabi, but they were, of course, very different than the ordinary Punjabi wife. And we really didn't have any close family friends. And when you would go into a landowner's house, well, I should say, when we go to a village, we would ordinarily be greeted by in a small village by what's called a zamindar, who is the man who basically is the major landowner of the village farmland. And a lot of the people who worked in a given village would be people who were essentially sharecroppers, people who worked the land for a percentage of the return, and the rest went to the zamindar. And we would always be greeted with offers of something to eat or drink, and if it was tea, that was okay. It was lassi. Lassi is a yogurt-like milk product, which is you can get in any Indian restaurant now, and lassi is fine. But the problem is that there's no ice in villages in Pakistan at that time. except when it was brought in on the back of a bicycle after a 20-mile ride. And a large cake of ice on the back of a bicycle after 20 miles would turn into a U-shaped cake of ice. And very often it would be filthy, and if you cut off some of the ice to put in the lessee, all you're doing is contaminating the lessee with the dirt and buffalo stool that's collected on the sides of the roads. So we were a little afraid of that. I didn't have any undue disease experiences in Pakistan, but I certainly was alert to it and tried to figure out the most politic way of getting around that problem. So we usually would either take a sip or two and then surreptitiously drop the rest somewhere, or do something else of that nature. I had a funny experience, not in Pakistan, but in India, relating to tea, actually. I was visiting New Delhi for a purpose of visiting collaborators. And I went into a tea house in Delhi and sat down and for lunch ordered a vegetable cutlet and a cup of tea. And you eat communally at most places. And a young Sikh came over and sat down across from me at the table. And he kind of hemmed and hawed, and it looked like he wanted to speak. And he ordered tea, but his tea, he drank it clear. Now, no Punjabi drinks tea clear normally, because it's always actually brewed with the milk in it. So just to break the conversation, I said, I asked him where he learned to drink his tea that way, and he said, oh, he'd worked in Afghanistan for a while. And then he hemmed and hawed a little bit more, and he said, you're an American? I said, yes. He said, I was going to go study in America, and the Indian government was going to pay my way. But I never got to go. I said, oh, that's too bad. And there was a silence for a minute, and then I said, where were you going to study? And he said, Minden, Nevada. Now, Minden, Nevada is a town of 200 people, and it's my hometown. And he must have been the only Indian who'd ever heard the word Minden, Nevada. And I was the only person from Minden, Nevada in Asia, as far as I know. So I looked around thinking that somebody had set me up, but it turns out they hadn't. When I asked him what he was going to study, it turns out he was a crop duster, and there was a school for crop dusters at the airport just outside of Minden. So he was going to go study in Minden, Nevada. My family, I started to say my family didn't really get to meet any other Punjabis, but it really wasn't as bad as it sounds, because my wife was Danish, and we became good friends with people who worked in the Danish Scandinavian aid organizations, and so we saw them a fair amount and had some social time with them. And of course there were a couple of Americans who worked in the institute that we got to know, so that was okay. And she worked as a librarian at the institute for a short period of time, so it turned out to be all right. We enjoyed our time. And we met a number of Pakistanis who were married to Danes and got to know those couples together, and that was fun. And of course subsequently I've gotten to know many Pakistanis. But I think on average, there are probably other places that we could have enjoyed socially much more. But Pakistan was a very vibrant country and had many interesting things, and we took many interesting trips up to the north into the mountains, as well as to India, and that was fun. As I left Pakistan, I went to WHO for a couple of weeks, and I was introduced to the Indonesian Minister of Health, a woman named Julie Sulianti, and she told me that she was very happy that I was going to come to Jakarta and live for a couple of years, which was news to me. And it turned out the DA had offered my services to Indonesia for running the eradication program in Indonesia, but unfortunately we'd already decided that we wanted to go back to the States and live, so I had to turn that down.
What would you say were the top factors that led to the success of the eradication campaign?
Oh, there's no question about what the talk factors were. They're just, I mean, I could use the word epidemiology, but that's unfair. Epidemiology is basically good sense with numbers, and that includes the topic of surveillance. And if I had to name one thing, it was surveillance. Surveillance, of course, led to judicious application of vaccination, and in the case of the eradication programs, normally it was done on the basis of a circle of eradication around what was thought to be the group at risk, as judged from previous cases. And I guess a better question to ask is, why hadn't eradication occurred before? I told you that it was my conclusion from both Europe and Pakistan that smallpox really didn't spread very far outside the bedside, and that's still my belief. Why hadn't it been eradicated in Pakistan and India before? Well, I would start out by saying that it certainly had been eradicated in many, many poor countries. Thailand, Egypt, Guatemala, lots of places without many resources, and smallpox was amenable to eradication on its own if there was some form of response to the presence of cases. It turns out that the British left a legacy in South Asia which was unfortunate. They managed to leave both countries with practices that tied the reporting of smallpox to the vaccinator, the person responsible for vaccinating. And of course, if smallpox occurred in a district and a vaccinator was told about it, he had two choices. He could hope that it went away on its own, or he could report it and get in trouble, because he shouldn't have permitted any unvaccinated people. That in tandem with the fact that very often the vaccination was done with a very dangerous, or I shouldn't say dangerous, but very hurtful circular vaccinator, which was a set of teeth which went around like this and carved a circle out of the skin, and was very painful and left a very commonly infected large wound, and it was usually done twice or three times. So people paid vaccinators not to vaccinate their children. So a very large proportion of people went unvaccinated who should have been vaccinated, and then smallpox occurred and was spread, and the vaccinator had to report it and he would get in trouble. Had that not happened, I think it might have disappeared from Pakistan before that. But in any case, certainly surveillance and ring vaccination were the two arms that led to eradication, and I guess I should say good management and very effective politics. And DA, of course, as a politician, convincing people and getting colleagues at WHO to be equally good politicians, convincing countries that eradication was feasible, made a huge difference.
How would you say that your experience with the smallpox campaign affected your life and career and afterwards?
Well, I certainly learned a lot about infectious disease epidemiology, and while I turned to chronic disease after returning to the States, when I came back to the States, I was appointed on the faculty of the Harvard School of Public Health and Division of Epidemiology. But I was the only person there that had any infectious disease experience and knowledge, so I had to teach infectious disease epidemiology, and I have always done that ever since. And I've had some occasional practice as well. And it certainly added to my enthusiasm for knowing what the differences between people, because that's the basis for descriptive epidemiology, whether you're doing cancer or infectious disease. So it certainly formulated my career in epidemiology, which has now been, 40 years. And I've used the same principles of surveillance to to basically set up a population-based cancer registry and run it in Los Angeles County. And in fact, interesting enough, David Thomas did exactly the same thing in Seattle. So we both ran population-based cancer registries and did etiologic research on various cancers and other diseases over the years. But I think more than I think was special because I started out at CDC and went into academic epidemiology, and there are really a big difference between the two. CDC epidemiology is basically practical public health prevention oriented. Academic epidemiology is much more causal epidemiology, trying to understand the causal relationships between environmental exposures and disease, or genetic exposures and disease. And they're both, of course, very important, but to forget exactly how you implement prevention based on knowledge is something that academic epidemiologists have only gradually learned on an individual basis, whereas CDC, that's the fundamental approach that you start with. So putting the two things together, I think, has been very useful for me over my career. And of course, much to my surprise, after 9/11, smallpox became a matter of a great concern, and I was the person who had written the most papers on smallpox epidemiology by that time. The people at CDC who were more concerned with eradication, they had a couple papers, but they didn't really describe much more than their experience in eradication, whereas we were much more systematic in the way we approached the topics. And I looked at the European outbreaks in much the same way. But all of that was water over the dam until 9/11. And then all of a sudden, the analysis of the European outbreaks became a topic of great interest. And I've written papers in the New England Journal of Medicine and in Lancet discussing the relationship of smallpox to dangers from terrorism, and smallpox to SARS and other infectious diseases which have represented threats. In fact, I think SARS experience in Toronto and in the Asian cities constitutes perhaps the best evidence that smallpox is not really a terribly important terrorist threat, because it would very quickly be taken care of by ordinary good public health methods.
Is there anything else that you would like to add about your experience?
Well, it'll take me a while to think of anything I haven't said.
Well, thank you very much for your comments and sharing your experience today. I appreciate it.
Sure.